Welcome to today's presentation on improving the referral process using Updox. My name is Katie Lashy and I'll be taking you through the presentation this afternoon. You've probably noticed that the phone lines have been muted as we're recording today's event, and we'll be distributing that recording to all registrants after the event. We will take questions at the end of the presentation. You're welcome to type and submit either as we go or at the end using the question section on your GoToWebinar panel, which you can click to open and type, and we'll get through as many as we can at the end of today's presentation. The reason that we're all here today is to talk about how Updox helps practices improve the referral process, but I did want to give you a little bit of background about who we are and kind of what Updox is all about. We were started about 8 years ago by an idea from a physician. His name was Dr. Andy Barbash, and he was frustrated with the communication solutions available to physicians at the time. The rest of the world had moved to simpler workflows with kind of the emergence of email or electronic mail. I think they used the full name back then. And unfortunately, with the HIPAA and protection of patient health information, that really limited physicians' abilities to use those tools and resources. And then everyone moved to an electronic world when it came to digital charting, but we still had this paper process here where you were sending and receiving large documents that were all paper-based, and then you had to figure out a way to get that into the system. So he was frustrated by that and got together with a few members of our team. And since then, we've really built a foundation for a communications platform that addresses more than just physician to physician. It also addresses physician to patient communication pains. So we'll talk more about the physician to physician side today, and we'll have follow-up presentations kind of going over some of those patient engagement solutions we've developed too. But over the years, what we've been able to do is help more than 40,000 providers and 250,000 users on a day-to-day basis. We've partnered with more than 70 different EMRs out there, and we help those EMRs service more than 60 million patients, which is really an impactful number because in 8 years we've been able to help practices service as much as 18% of the U.S. population. And what we've become for them is a single source for both patient and provider communication. So what types of problems do we help practices solve? Kind of what's the plight of the independent physician today? What we've heard is that paperwork and faxing can be both time-consuming and inefficient. You also have an issue with audit trails and recalling faxes that we'll talk through here as well. Playing phone tag and voicemail with patients all day, again, time-consuming and inefficient, and it takes you away from providing care. No-shows or vacancies in your schedule are frustrating and also financially impactful. And then we have concerns with patient loyalty year over year now that we're kind of competing for patient business in this consumer-based world. There's also the consideration for burdens of meaningful use and other requirements, ICD-9, ICD-10, there's something new each day. The growing needs of chronic care patients as our aging population continues to grow. And then staying overall independent and financially viable amidst all of these concerns while maintaining a referral network. So these are some of the problems that we hear speaking with independent physicians on a day-to-day basis that we help solve. And what we do as a partner is challenge ourselves to align with your primary goals. The most important goal is obviously to improve the care that you provide to your patients and keep them healthy. But a consideration for any business, large or small, is going to be the bottom line, maintaining a budget, and cutting unnecessary costs wherever possible. Technology can absolutely help streamline some of these processes, but what we've learned through our conversations with these physicians is that if you adopt too many systems, you're maximizing and minimizing windows every 5 minutes each day. It actually becomes a more cumbersome workflow to partner with multiple solutions to solve multiple problems, whereas what Updox can do is consolidate in a single application that's as easy to use as email several different pain point solutions to help your practice work more efficiently. So you have one application, one partner, one support channel that works really, really well with the EMR that you're using. Essentially, we help practices do more with less. We help you multitask more efficiently. The types of solutions that we offer to our customers are comprised of both patient engagement and practice optimization. So from an engagement perspective, we do have the ability to do appointment reminders, notifications, care management, relationship development. And then from a practice optimization standpoint, we can help digitize the referral process, coordinate patient labs and prescriptions. We have a really great web-based interface for inter-office communication and remote clinic access. And we're, of course, HIPAA compliant, as we were designed by physicians for physicians. The section that we sent, the area that we centralize these messages is the Updox inbox. So this is a web-based application accessible anywhere with an internet connection. And what it's going to do is bring in electronic faxes, appointment notifications, inter-office messaging, outgoing faxes. It's going to be a one-stop shop for all of these different types of communications in your day-to-day. We color code and label them to make them really easy to find and help keep you organized. You can even filter by message type at any given time. Our inbox also has custom tags so that if you wanted almost a digital foldering system where you could have a tag for each person so that 3 of you don't need to determine that Susie needs to look at this. Or if you wanted to do tags for urgency so that you're prioritizing high impact items by giving them a red tag or signaling that something's green and ready to be sent. We have all of those functionality and workflow systems built in as well, all in this document management system. The feature specifically that we're going to speak about today as it pertains to helping improve the referral process when you're communicating with other physicians is our electronic fax and document management. And the way that we've really differentiated ourselves across either a paper-based system or a fax server-based system is that we make it really easy to review, split, or combine pages. So for instance, if you have one document coming in and you have several patients included, so it needs to go to a few different chart sections, it's really easy to just grab a few pages at a time. Or if you're pulling multiple things from the chart but they're all going to the same place, it's really easy to combine separate things to send them out as one rather than faxing 6 things individually. We also make it really easy to sign and edit inside of our application, which I'll show you here in a moment. And we have a great drag and drop feature so that if you have any file on your desktop, you can drag it into Updox and send it out or send it into the chart. So a really great feature there too. We do use one sending screen, both for faxing and filing, so that you can multitask. If you have a document coming in and it needs to be faxed out, but you wanted to note in the chart that you had faxed that out, you can actually fax it out and send a copy to the chart with a note that says it was faxed to this number at this date and time. So not only can you do 2 things at once, but you have a really great audit trail that follows along with it. Again, our application is web-based, so it's accessible anywhere with an internet connection, which helps give practices access to some of their workflows kind of on the go. You can even access it from your phone so that you could review, file, or fax back out all from any mobile device. There's no hardware, so no software or IT support required, and we have great support resources to help everyone get up and running on the onboarding side too. Talking through the specific steps in our workflow and what it would look like if you were to move forward with managing your referrals by fax with Updox, you would log into the web-based application, review your fax, break it apart if you need to, edit or sign if you need to, and then send out as a fax to the patient's chart or even both at the same time if you needed to. Again, these are going to be centralized into this web-based inbox where you'll be completing these workflows. And what's nice about this inbox too, it's situated intentionally to look a lot like your email inbox. So it's a very short learning curve when it comes to Updox. Your newer messages are going to be on top, your older messages are going to be down below. You can actually mouse over the little thumbnails that you're seeing here and preview the fax, kind of determine what it is and what your next step would be, and what pages you need to send if you're going to send pages without even opening the document at all. Now, if you did want to open the document to edit, we'll go over that as well, but sending to the chart would be as simple as choosing your pages and hitting the send button. Here's just a bigger view for you so that you can see that a little bit better. So you'd be able to run your cursor over these thumbnail previews to zoom in and kind of see what you're trying to do there. If you did need to apply a signature, we built a full-scale editor that mimics the things that you might do if you had a piece of paper sitting in front of you. So typing notes, numerical values, freehand drawing, erasing or redacting, highlighting items, those are all workflows that you're able to accomplish with Updox. You also have a time and date stamp and a checkbox because we understand there's a lot of forms and time-sensitive workflows associated with medical practices. And then the real aha moment for physicians and office staff alike is that we have a one-click signature so that each user can store their own signature in the system and they can digitally sign documents on the go. As a key point of our integration with these EMRs, what we work to do is be able to send a document into the chart. So when we're filing to a patient's chart, we look for the fields that you have inside of your EMR, whether it's the name of the document type or category, which provider you're assigning it to. So most of our integrations include the ability to task or create inbox messages for physicians when sending to the chart, so that if you have someone that's managing the administrative part of that, and then the doctor doesn't want to go into Updox, they just want to, end quote, sign off on documents once they get to the chart, you could even manage that workflow with Updox so that they get inbox messages or tasks, or we can send to the dark side for any Greenway users out there, all through this sending screen. Now, if you are the provider and you are kind of a one-man, one-woman show managing the faxing process, you can sign off on documents while you're filing them too, because anyone that has signing privileges inside of the EMR will see this sign button appear in the sending screen too, so that you could sign off on a document as you're filing. And again, with each integration, we try to mimic the workflow that exists inside of that EMR so that this sending screen has no sweat to pick up for a new user as well. The other great thing about our sending screen is that we pull those little thumbnail previews onto it too. So if you're faxing and filing hundreds of documents per day and you forget the date of birth or the date of the lab draw for the patient that you're sending to or on behalf of, you can mouse over the thumbnails here too and kind of remind yourself of that small detail and a small detail that is a big detail and not make a clerical error there. The other great thing about our sending screen is that you're able to complete 2 actions at once. So I had mentioned earlier on that you're able to fax and file at the same time. So if you're sending out, or if you're faxing out information, but you want to also send that to the chart and keep a copy of it there, you can click the search for additional contacts or users field on the sending screen and go ahead and type in the name or number of a fax that you'd like to send, all from the same screen. And if you had to send a document 2 places, you can even fax out 2 different places with 2 different cover sheets the same document, if that need exists as well. In regards to outbound faxing, we have customizable cover sheets available out of the box. They'll contain your practice's name, fax number, name and number of the place you're faxing to, and then anything that you add in the subject and note section as well. We've recently built in the ability to have multiple customized cover sheets. So if you need a cover sheet by location or by department, you can pick and choose from this little drop down here. And then if you find yourself typing or scribbling the same message over and over again on that cover sheet, depending what type of document it is, you can even create templates for yourself. So please call the practice with any questions. Please notify the patient when this is ready. You could even pre-configure those templates so that rather than keying in 50 words, you're just double clicking to choose the template that you send often. So anything that we can do to save you clicks or time in your workflows, we're all over that as far as our priorities go. The other thing that we hear about quite a bit when it comes to referrals and faxing is that fax failure is still very much a problem in the faxing world for physicians today. So the way that we cover that, rather than having you sit at a fax machine and wait for a transmission report or try to recall it in a fax server, we actually proactively notify you if a fax fails for any reason. So at the top of your inbox, we'll say fax failed at this date and time, this was the original attachment, this was the number we tried to send to, so that if they are still using a paper-based process and they're throwing up a busy signal because they're receiving a big document, we'll try 5 times, and when it fails, we'll let you know, hey, it failed, there was a busy signal, try again later. If their fax machine's offline, we would tell you that their fax machine was offline, so you'd need to, notify them and then try and send again. So there's no more waiting to hear if something went through or not. Now, the other situation we hear about as it pertains to fax success and failures is that even if you don't get a failure, there is a chance that 3 days later that practice is going to ask you to resend something because it was misplaced on their end. So in a paper-based world, you would redo the work from start to finish to send that fax out. In a fax server world, you'd probably have limited ease in kind of recalling that fax and sending it. With Updox, much like an email inbox, you can go to your sent box at any point in time and search by the name that you sent it to or the fax number you sent it to, and we will retrieve all of the documents that match those search fields that you had used. And this also pertains to chart filing. So if someone doesn't know who filed something to the chart at any given time, they could hop into the sent box inside of Updox and look who was filing documents into the chart just as easily as they could find who was sending faxes and what the contents were. So a really, really great audit trail, not just for faxing, but especially helpful for those instances where they're asking you to redo something that you've already done once. From a revenue perspective, workflows sound great. If the price point doesn't match your budgetary concerns, it's absolutely not going to be a fit for you. So when we talk to practices, what we find out is that if you ask a paper-based practice how much they fax, they will almost always say a lot, because there's definitely a perception of a lot of faxing going on. So that's universal across our customers, and we absolutely understand that we need to keep it affordable for that reason. What they don't recognize right off the bat is how much the a lot is actually costing them. So if you consider 5,000 pages, it's actually going to cost your practice about $80 per month or per 5,000 pages in toner. A fax line can cost a practice anywhere from $20 to $40. A ream of paper can be as much as $50 per month. So while you don't feel like you're paying a faxing partner for that, you are paying several different sources for a process that doesn't match with your workflow. Because at the end of the day, it also costs your practice double the time each time managing those faxes and double the frustration probably dealing with that hardware. So going digital with Updox, what we're able to do typically for a 5,000 page rollout spread across a year, so kind of a monthly roll up then, is a $7,000 savings over a paper-based process using Updox with consideration of some of those time constraints. So that's a quick overview of our faxing application and how it can be tied to managing the referral process. I did want to let you all know kind of the bottom line when it comes to revenue savings across the board here. So we have the $7,000 that we could save you with the paperless fax. I'm not sure how familiar our audience is with some of the other solutions we offer, but we're also able to reduce the bottom line when it comes to no-shows by as much as 12,500, blast messaging as much as 9. And what those things would be inviting patients to flu clinics. So that's a really great use case. Getting no-shows back on the calendar, a really great use case for our blast messaging. Our reminder solution, pretty obvious, straightforward. We do phone, text, and email reminders for our partners. Patients have the ability to confirm and cancel. We can support human voice, different messages by reminder. So really great solutions we have there as well. I know that we're focused more on faxing today, but I did want to give you a big picture of the impact of Updox from an ROI perspective when all of these solutions are working together. And again, we will have follow-up sessions on some of those additional topics too. How would you get started? If you're ready to move forward with Updox, if you've been kind of watching for a while and you're ready to speak with someone, get a custom price quote, find out how it matches your workflow, we do have our sales development reps follow up after each event to find out if you had any additional questions, if you'd be interested in a 15-minute phone call with one of our product experts to kind of sort through that. They're great at both giving you customized quotes as well as a customized demo with consideration to some of the pains that you're feeling at your specific practice. So I definitely recommend sitting with them for a 15-minute session if you have the time. We do offer a trial period for all new customers, and we're month to month after that. So if you were to try Updox for a few months even and it wasn't a fit for you, there's no long-term contract. You're able to cancel anytime, which is really a great value to our customers as well because we're on the hook to keep you happy with our service month over month. We offer free training and technical support. And as I mentioned, we'll be following up after the event. But if you wanted to talk to someone today, you're welcome to contact us at 614-798-8170 option 1 or sales@updox.com. And I will say that we're nearing the end of the month, so while I don't have a special webinar promotion or promo code for you today, I do believe that our account executives would be happy to talk pricing with you and come to a solution that works for us all. Now I'll go ahead and hop into our question section here. First question, are we recording today's presentation? We are recording the presentation, and we'll be sending the recording as well as the questions, as well as the slides, to all registrants after the event. I have a question about fax machines tying up the line. So the way that Updox fax works, we are actually server-based. So if you're receiving a large fax, it is on a different line than your sending would be. So in a lot of practices, what they'll do is wait until the end of the day to send a really large document because they don't want to tie up their fax line. With Updox, you could be sending and receiving simultaneously without any busy signals. You could even be receiving from two different places at the same time without that busy signal. So rather than kind of one road in, one road out that you'd be experiencing with a fax line, you actually, when a call comes in, it hits a room full of servers, and then we put the call through. So a lot more in and out roads with Updox and the end of busy signals as it comes to your practice. A question about keeping fax lines. So most practices that we work with do have an established fax line. So we can either call forward your number to the one that we provide included in our solution, or we can port the number over to Updox. Either way, you're not giving out a new number. But if you are just getting started and you don't have an established fax line, you could certainly use the Updox fax line as well. And I think that's all we have for questions. Thank you so much for joining me this afternoon. Again, we'll be sending the registry or the recording as well as the presentation slides out after. Have a great afternoon. Thanks so much.